Menopause is one of the few times in life when hormone imbalance feels real. Not because your body has failed, but because it's a natural and normal transition of life. In this episode, we'll talk calmly about what actually happens to your hormones, why the changes can feel so intense, and how to navigate them without fear or hype, but with understanding. If you haven't watched the earlier episode, your hormones are out of control. Who told you that? I recommend seeing that also. It shows how this whole concept of imbalance arose. But today we'll focus on when hormones truly change, menopause, and how understanding what's happening gives you more control and confidence. For decades, women have been told their hormones are wild, that they're hormonal, out of control, or even broken. The word hysteria in old medicine was used to label this phenomenon. The truth is more grounded. Hormones are chemical messengers, and in midlife, they are adjusting to a new rhythm of life. Estrogen and progesterone, the two central female hormones, start to fluctuate, sometimes dramatically. Cycles shorten, skip, then stop, and unpredictably come back. The ovaries are maturing and retiring from a productive life of activity. This is often accompanied by hot flushes, night sweats, mood changes, and poor sleep. The body's way of responding to hormonal fluctuations, and in some ways, it's like puberty again. Unpredictable moods, slammed door, and confusion, only in a different season of life. The problem is, popular media has turned menopause into an industry of cures, fixes, detoxes, and bioidentical resets, often without evidence. Every influencer, including some health professionals, seem to sell a miracle or a natural fix. The irony is that menopause is not a disease to be fixed. It's a stage of life to be understood, embraced, and managed, like any other stage of life. Let's start with what's normal. Medically, menopause is defined as 12 months after the last period, and the years before that, perimenopause, can last 4 to 10 years. And that's when the roller coaster happens. Estrogen surges and drops unpredictably, progesterone declines, and symptoms flare and fade in waves. For many women, that unpredictability, not just the symptoms, is what feels like imbalance, or what some people playfully call the puberty blues of midlife. When menopause arrives, usually early, between 40 or suddenly after surgery or chemotherapy, the transition becomes more abrupt, more sudden, and symptoms can be far more intense. Doctors call these early menopause, which is outside the usual rhythm and therefore harder on both body and mind. Premature ovarian insufficiency, or POI, however, is different again when the ovaries switches off far earlier than expected, as in teenage or early adulthood. Fortunately, but uncommon, when it happens, it can be very and deeply distressing. So, why does menopause happen at all? In physiological terms, it's a reset of the body's priorities, shifting from reproduction to preservation. Once fertility ends, the body no longer needs to maintain high estrogen levels for ovulation, implantation, or pregnancy. So, energy and nutrients can instead be redirected toward repairing tissues, maintaining metabolism, and protecting long term health. Estrogen and progesterone settle into lower, steadier patterns, allowing other regulatory systems such as insulin, thyroid, and adrenal pathways to take a larger role. This shift may help the body stabilize after decades of cyclical change. It's part of why women continue to live well beyond the childbearing years. The body shifts from creating new life to sustaining the life it already has. It ends the monthly iron loss of menstruation, conserving nutrients for years ahead. Another quiet form of preservation. Falling estrogen can change that balance. Bone, brain, and heart health become more vulnerable as estrogen protective effects gradually lessen. It influences serotonin, temperature control, and blood vessels, so its decline can ripple through sleep, mood, and metabolism. But these changes are part of life, not a failure of the body. Most women adapt naturally through healthy habits, regular weight bearing exercise, through enough calcium and vitamin intake, good sleep, muscle maintenance, limiting alcohol, and a balanced diet. In the past, women simply adjusted their routines, diet, activity without medical support. Today, however, medical options such as menopausal hormone therapy exist to ease symptoms when they become severe or disruptive. It's not about fixing a defect, but about restoring comfort and function when natural adaptation becomes difficult. The goal isn't to reverse menopause, but to help the body move through it more gently. Menopausal Hormone Therapy (MHT), previously known as Hormone Replacement Therapy (HRT), has had a turbulent history. It once was overprescribed, then underprescribed after the Women Health Initiative study in 2003 raised safety concerns. The terminology itself has since shifted from replacement to therapy because medicine recognizes that menopause is not a deficiency or failure, but a transition. In recent years, the science has become clearer. For healthy women under 60 or within 10 years of menopause, MHT is considered safe and can relieve many symptoms. The key word is individualized. We now have evidence based bioidentical MHT, menopausal hormone therapy, that is TGA approved and PBS subsidized as of July 2025, a welcome step for many women who felt forgotten. These formulations are well studied, consistent in dose, and monitored for safety. However, outside regulated medicine, a different market has grown. Some compounding pharmacies and alternative networks also sell bioidentical hormones that are not approved by the TGA in Australia or the FDA in the US, often claiming to be more natural or pure. In reality, their doses can be unpredictable because there are no standardized studies or quality controls. That unpredictability can lead to irregular bleeding, endometrial changes, and misdiagnosis when symptoms are masked or misread. It's not the word bioidentical that matters. It's the evidence, regulation, and ongoing medical supervision behind it. So before you treat a number, treat the person, yourself. Keep perspective. If you're having symptoms that disrupt sleep, intimacy, or mood, see your doctor. Many clinicians, including GPs, family physicians, and endocrinologists, have a special interest in women's health and can guide safe, coordinated care. Menopause doesn't erase identity, it reveals it. It shows which routines still nourish you and which no longer do. Many women at this stage rediscover exercise, take up hobbies, new hobbies, travel, learn, or even start second careers. The same curiosity that once drove youth in puberty can now fuel wisdom. Culturally, medicine owes women better language. Hormone imbalance sounds like a problem. The reality is hormone transition. The body isn't misbehaving, it's adapting to the new you. If you're listening and thinking, but I don't feel like myself anymore, that's valid. Menopause can affect serotonin, sleep cycles, thermoregulation, and skin. Thinning hair, drier skin, and slower wound healing are common. While these changes can be distressing, they're not signs of decline. They are reminders that skin and hair now need a little more care, moisture, and protein. I've also have videos. I also have videos on maturing skin and how to care for it, both from the inside out and outside in. Healthy lifestyle choices really help. Keep muscle active. Muscles are hormone friendly tissues. A 20-minute brisk walk daily improves insulin sensitivity and mood. A diet rich in plants, protein, calcium, and omega 3s support bone and cardiovascular health. Small, consistent habits work far better than expensive powders. In short, menopause is not a malfunction, it's a milestone. The goal isn't to fight your hormones, but to live in sync with them as they change. When you stop chasing balance and start building confidence and calm, you rediscover stability in your own rhythm. I'm Dr. Chris Ho. This is No Hype Health Talk. Thank you for listening. And if this helped bring clarity or reassurance, share it with someone going through the same stage of life. You can find my playlists on these topics. If you believe in supporting no hype health information and education, please subscribe and share this video to help spread a balanced, calm approach to health and well being. In a world that's flooded with hype, half truths, your voice helps already to steady the waters.